I would like to welcome Dr. Bredell with us again today. We have a big topic to discuss, and that's adrenal fatigue, or the misnomer. It's not really a condition that's recognized by the medical profession unless you have Cushing's or Addison's.
Okay, what a wonderful topic to talk about, and thank you for having me again. So it is a misnomer, and it's very important that people understand this. So I would say adrenal fatigue is correct in that that there is fatigue and that the adrenals are involved. But more correctly, it is called the HPA axis dysregulation. So I will explain that. Hypothalamus, pituitary, adrenal axis. So it's a communication system between the brain. Very seldom do you have actual adrenals not producing cortisol.
Where are they positioned?
They're positioned on the kidneys. On the top of the kidneys you have your adrenals, and they actually produce 57 different molecules, of which adrenaline, norepinephrine, DHEAS, cortisol, mineralocorticosteroids are the most well known.
Critically important little glands.
Critically important. All got to do with the stress response. And you mentioned Addison's. Addison's disease is where there's destruction of the adrenals by either an illness like TB or some rare infections. More common in the modern world because of autoimmune diseases. You can almost call it Hashimoto's thyroiditis is an autoimmune disease of the thyroid, autoimmune disease of the adrenals in modern life, where we have lots of autoimmunity conditions. You destruct it, and then you can't produce this, and this can be life-threatening. There's something called an Addison crisis. We actually need to give somebody cortisone to save their life. Cushing's is an overproduction of a stimulation from the hypothalamus pituitary glands to overstimulate corticosteroids, which gives you big fat people. So the one is too much, too little. Adrenal fatigue is something else.
Just to go one step back, what would the symptoms be of Addison's and then of Cushing's?
Addison's usually an severe muscle weakness, pain, abdominal pain, vomiting to the point where you have dehydration, blood pressure drops, a real crisis, an abnormality in electrolytes.
And it's just a sudden onset?
Usually triggered by acute stress, an infection.
So like a car accident?
Yeah, a big shock. You can have it underlying, and then a crisis exposes it. I've never seen it. I've heard about it. Can be very effectively treated.
So but something to just with adrenaline or cortisone.
Cortisone. It's a cortisone problem.
But where's the adrenaline link?
Adrenaline also gets produced by the adrenals, and it's one of the hormones that we release in a stress situation. But that's more the acute one that gives you palpitations, anxiety, irregular heartbeat, sweating. That's the fight or flight, acute fight or flight.
Which also can happen in an accident.
Yes, but that's an acute response. With Addison's, you might have an acute response because of an accident, but with Addison's, you'll end up in hospital with that.
Yeah.
Something rare, but easily treatable, and long term you give them hydrocortisone as a treatment.
So just to clarify 100%, you will most likely only get diagnosed if there's been a severe stress trigger and you've had this failure to respond like a normal person would.
Yeah, some people would just would present with just fatigue and not handling. They would pass out easily. You have to look for it. If it's not exposed by acute stress, it's something that you have to go and look and test for, but not common. adrenal fatigue, which isn't adrenal fatigue, that adrenal glands aren't fatigued. They're just not responding to, or the messages that they're receiving aren't correct or
So
are
they're not tired.
mismanaged. They're not tired. Most of the time they're not tired and they can produce, but the information that they're receiving is incorrect. And that's the big problem. We focus on the adrenals. It's not the adrenals. It's this whole hypothalamus pituitary axis dysregulation. And that's why it's not a quick fix. The beauty is there's such a lot we can do. So we have to talk about...
Yes, before we do, just differentiate between adrenal burnout and adrenal fatigue.
I don't know what adrenal burnout is. I think it's one of the...
It's almost like it's past the fatigue stage.
But you don't get adrenal burnout.
So
I would say adrenal burnout is closer to Addison's disease. Adrenal, you don't get adrenal burnout. You feel as if you're burnt out, and that's a tiredness, weakness. You sleep 8 hours and wake up and you're still tired. You go and have a nap in the afternoon. You don't sleep well. You either battle to fall asleep or you wake up and you lie awake. It's this whole fight or flight system that acutely is good, but in our modern life it just continues. It's just chronic stress. We see it all over the world. People are just not coping with chronic stress, and chronic stress is not just work stress, it's all the other stresses, the biochemical stress that we have, the chemical stress, the toxicity, the TV, the pads, the late nights that we don't sleep well, the coffee we use for stimulants, the sugar. The biggest problem probably is sugar, widely ranging sugar levels, which causes stress in the body.
What brings along this dysregulation?
So our genetics is programmed to handle acute stress. You see a lion, you either fight or flight. We are not supposed to have chronic stress day in and day out over a long period of time. So it's a good thing to have stress. You kick in your acute stress reaction, but if it continues, this whole regulation of cortisol, of sleep, of energy, of sugar gets
That's
upset.
the important point. It's not that, as you're saying, that's very interesting, that the adrenals are fatigued and they're no longer producing cortisol and
There's
adrenaline.
enough cortisol.
It's the dysregulation. So it's proportionately the levels that's the issue.
So that's an important point. Normally, we wake up in the morning, we have cortisol. That kickstarts your day. And then it slopes down. At night, it needs to calm down, otherwise you're awake. What happens now is we stimulate you try and run and get modern life going, and now we use stimulants and we eat junk food and our sugar goes up and down. What eventually happens is the cortisol in the morning goes down and the cortisol at night goes up. So now you can't sleep, you can't get your rest, inflammation happens, your sugar levels go haywire, and because of that you wake up in the morning and you're tired. Eventually both morning and night it goes down.
So that's where you end up with at the
then
doctor saying, I'm
really
tired,
gedaan.
I'm finished.
Tired.
Okay,
You're finished.
Such a good word.
That's a bit gedaan. So the treatment is not just to give the person cortisol, because he has got cortisol. In fact, you can worsen it. You need to find out, is he in balance? Is the person in dysregulation, or is he totally out of regulation?
How? Through saliva tests and measuring the cortisol in the morning when you wake up to see where your level is, because that's quite the indicator.
It's ideal is to do four levels: early morning, later in the day, early evening, and in the middle of the night. Then you have a complete picture. But sometimes they just do in the morning and at night.
So
I would
do saliva testing where you spit in a little tube, and then you label them when it was done, and you send that back to your doctor, and it gets sent off for analysis, and then they've got your profile.
Yeah. Ideally, I would do the plain cortisol level 2 and sometimes ACTH, the adrenocorticotropic hormone, that's the HPA axis hormone that regulates the adrenals, to get the complete picture. But you can get a very good idea by just asking a list of questions, and you can see, are you wired and tired, are you overwired, or are you exhausted? Where are you in this continuum? And that's why people shouldn't just take a supplement, go to the shop and say, I am tired, I think I've got adrenal fatigue, and you get a product, because some products need to be taken early and some products you need to take later in this whole continuum.
Not during the day, you're talking about the picture.
The whole picture, there's a continuum of this. To treat it, you have to look then not so much at the adrenals, but to look at what's happening here. And what's happening here is our day-to-day life, our stresses, our joy in life, our exercise, sleep.
You're talking here, you meaning mind, body?
I mean emotions,
right.
Mind, body, experience of stress. So before taking supplements and things, all I think people can do to give them really good advice is make sure you don't have too much coffee. That's a stimulant. Make sure you eat decent carbohydrates. Don't eat junk food that mucks with your blood sugar levels. Eat carbohydrates, complex carbohydrates, vegetables in the skin, vegetables full of fiber. Go to bed early enough. For every hour that you go to bed before 12, you add 2 hours to your sleep. Switch off TVs, computers, phones.
Electronics.
Good 3 hours before bedtime, before you get into bed. The blue light in that upsets melatonin, which is an important hormone for sleep. It upsets that whole
But
axis.
if you're so exhausted and you've lived a full life, first of all, it's going to be very difficult to discipline yourself to reverse that lifestyle that you've become accustomed to and that people demand of you. That's the first thing I find I have a problem with. And the second thing is...
How much have you got a problem if you're going to die from that?
Okay. The second question is, how long would it take for me to stop living that lifestyle?
If you've done that over decades, it's going to not happen overnight.
Because if you're talking, do the test to see where you're at, and then look at your diet.
It's more than diet.
And
lifestyle,
have joy.
diet, yeah.
How long before you start to see your energy levels pick up, and is this completely reversible?
It is completely reversible because our bodies are just incredibly wise. It's got all the knowledge and wisdom to repair, but it needs firstly to have the cause removed. You can treat with all the tablets and nutrients and supplements, but if you don't remove the cause, but it won't happen overnight. Within weeks you'll feel, I mean not days, but within weeks you can have I would say 3 to 6 months to be really back to completely normal, but within a month one can have a big change.
So you really need a good holiday sometimes. You just need to go away for a month.
You have to do that, but you also have to manage your day-to-day. It's that day-to-day stress that you have to... It's
not break for a month holiday and get straight back into the living the life you must wake up to the warning signs.
So, exactly. So there's this task,
Oh, sorry.
Learn the lesson, otherwise you're going to get it again and again and again. The Whitehall study, Whitehall 2 study, looked at blood pressure, blood sugar, cholesterol, one other thing, and the HPA axis dysregulation. And the biggest predictor of all of that, of death, was that cortisol dysregulation. So that's why I'm so serious when I say it's as serious as early death. More so than your sugar, your blood pressure, your cholesterol levels. I mean, that's amazing.
Stress is a killer.
Stress is a killer. So I can quickly mention just some of the things you can do. Magnesium, make sure. Western Cape is depleted of magnesium, by the way. We
Okay.
need, everybody here needs extra magnesium. Vitamin B12, things like coconut oil, raw fresh dairy, real good organic meat, and then probably the most well-known repairer and supporter of this stress response is the adaptogens, ashwagandha, rhodiola, withania, licorice root, ginseng.
For me, so by the way, ashwagandha is immediate. Literally immediate. I pour a big tablespoon into a smoothie when I feel like I'm not coping, and it just literally calms me down. It's
probably the most well-known, best adaptogen. But then you're still treating. You need to...
Yeah.
That's such an important thing, to first remove the cause and then treat. Even in natural medicine and in naturopathic medicine, we tend to treat things. The first step is remove the cause. Otherwise, you're going to keep on treating. And I want to tell people that you cannot smoke and then treat asthma. You cannot stress and then drink coffee too. You said it.
So nice to have you back. Thank you, Dr. Bredell.
I hope you've taken something. I must say, this lady, I don't know how you keep going. Well done.